Hello and welcome everyone to today's ePAG Exchange of Good Practices webinar on the topic of designing surveys. My name is Lenya Via and I work at Eurodis as a Patient Engagement Senior Manager. Here you can see the agenda for today. We have a short 5-minute introduction. After that, our first presentation, a theoretical introduction to the topic of designing surveys. We then have a 10-minute questions and answers session, and then our second presentation, co-designing surveys for rare diseases, the ERN ReCONNET journey. After that, we have a longer Q&A session of about 25 minutes, and then a short wrap-up. I'm very happy that we have these 4 speakers here today. All 4 have a wealth of knowledge and many years of experience on the topic of designing surveys. Jessie Dubrief is our first speaker. She will give us the introduction on designing surveys, and she works at Eurodis as a rare barometer research executive. So she works for Eurodis's survey program. Ilaria Galetti represents the Italian Systemic Sclerosis Organization, and she's an ePAG advocate in ERN ReCONNET. Silvia Aguilera is also an ePAG advocate in ERN ReCONNET, and she represents the Spanish patient organization SAFE España. And finally, Diana Marinello is the ERN ReCONNET network manager, and Ilaria, Silvia, and Diana will give the second presentation about which will be about the design of 2 different surveys. Okay, without any further ado, I hand over to you, Jessie, for our first presentation today. Thank you.
So the idea of this presentation is to have a broad introduction to survey design, and also to answer some of the questions we're being asked quite often regarding what is a good sample, how to avoid bias, and you'll see that the answers are not always straightforward, but I will try to give you a broad introduction and give you some tips to survey design, knowing that if you well, depending on the use that you want to have of your survey results, you may need to ask for a professional social scientist or methodologist or statistician to help you, especially if you want to publish in a peer-reviewed journal. So first of all, I wanted to specify what when we talk about surveys, what do we talk about? Because most of the time I can see that there can be a mix between surveys and questionnaires, for instance. So the survey is really the whole process, and it includes several steps, at least the 5 that you see here. And the most important is to make sure that each step is relevant to answer your research questions, so the questions that you ask yourself. So there is no such thing as one methodology for all surveys, one way of reaching out to respondents or of analyzing the results. It all has to relate to which questions you are asking yourselves and how you answer to those questions. So the different steps is, of course, the preparation, where you need to make sure that you have everything you need and that you have the right questions. So what do you want to know? For what goals? Who is your target population? Do you want to present the survey only to the patients or to your community? Or do you want to present it to decision makers for advocacy? Do you want to present it to scientists to have a robust survey and show them the results? But also, does the information already exist somewhere, maybe for another country, and maybe in that case you can compare afterwards? Is there anybody else that is interested in the survey that you are doing? And can you join forces? Because then that will allow you to avoid to multiply the number of surveys that you are doing, or to duplicate surveys that are already existing. And what are your resources? You have to think about that from the very beginning. The resources that you have for data collection, for dissemination, and especially for analysis, we can be long and quite complex. So the second step is data collection. Then you have the dissemination itself of the questionnaire most of the time, but also it can be interviews. You have the analysis and making the most out of the results. So for the preparation, the first thing you need to ask yourself is, what do you want to know? What are, in a way, your research questions? So you can make a list of the questions you want to know the answers to, or of your hypothesis that you want to test or to check in your survey. You also need to know what are your final goals and objectives, and which something that is linked to that is who is your target audience. So for instance, you can just want to involve your members to shape or improve your organization strategies, to collect unmet needs in your organization or in a broader way, to reach out to decision makers in order to have an evidence-based advocacy, or to shape healthcare activities. In that case, that would be very interesting to involve clinicians and healthcare professionals in the making of the survey, to assess and improve patient experience or care outcomes, to write, well, to publish the results in a peer-reviewed journal, for instance. So then the design will really depend on that. So if you want to look at if the information already exists, you can first have a look in the scientific literature. So you can use PubMed or Google Scholar, but also the gray literature through an internet search or discussions with a specialist who can give you access to some literature. You can also have a look on the Eurobarometer website, where we give the results to all of our previous surveys. So we give an open access to all the general results, but you can also have access to specific results if you are a member of EURDIS or of RDI. So for instance, results for your disease, for your country, or for your group of diseases. So in that case, you can just analyze the results of previous surveys, or even participate in current surveys or upcoming surveys. And in that case, you can also have access to your own results if you have enough respondents. Can you join the forces, especially on the cross-cutting issues, maybe with other patient organizations, or also with Eurobarometer if we intend to do a survey on the subject? And what are your resources? What is your budget? What are the human resources you can count on, and the competencies? What is the scale of your project? Then you go to data collection. So I just gave two tools that are mostly used for data collection. Usually the most used is questionnaire for many reasons, but I mean, it may not be the most useful depending on the questions that you ask yourself. So a questionnaire, it's a list of questions. They can be closed or open-ended that allow to measure a specific phenomenon. It is part of the quantitative methods in social science, along with other methods that also allow to measure a phenomenon, either directly, like counting people, if you're doing observations in a hospital unit, for instance, or indirectly if you use existing databases. And then you have the interview. So most of the time what we use is semi-structured interviews, which consists, well, you ask questions, but not as systematically as in a questionnaire. You have a list of questions in the form of a guide, and you just want to make sure that you ask all of the questions that are on the guide, but it usually takes the form of a conversation. So it is part of the qualitative methods in social science, along with observation, archive analysis, or other types of interviews. Once again, so this is also based on the main questions that we have. So one very important thing for you to have in mind is the difference between your population and the sample. So you will not, well, unless you reach out to your whole population, for instance, you have a disease that, well, you have, for instance, 100 people living with one disease, and you reach out to 90 of these people. So it's almost the whole population. So in that case, your sample is quite close to your whole population, but usually you just have access to one part of the population, which is the sample. So the sample, there can be different types of samples, and for instance, the one that is usually that we usually try to reach out to is a representative sample. But to have a representative sample, that supposes that you know the structure of your population, how many men and women, how many people living with such rare disease do live in your population, and usually for rare diseases this is not known, so that's not very feasible usually to have a really representative sample. However, you can do purposeful sampling, where depending on the questions that you ask yourselves, for instance, if you think that what you want to measure differs if patients are male or female, you can try to reach out to enough male and females so that you can compare the answers to your questions. So then you just try to have enough respondents with the characteristics that you are looking for, so that you can compare results and see what are the responses of those people. And so then you have, once you have decided on who you want to ask your questions to and how you do your sample, then you also you write your questionnaire. So in the do's and don'ts, do not confuse the research questions, which is the questions that you ask yourself. For instance, in the diagnosis survey, we were wondering what were the most impactful factors on the length of the diagnosis journey for people living with rare diseases, but we want to ask this question as such to our respondents because they wouldn't know how to answer it. So we divided so that we can answer to this question. We came up with many questions that we do directly ask our respondents. So this is the questions that will be in your questionnaire. And also, when you are writing your questionnaire and the questions that you ask to people, make sure that those questions allow you to distinguish, well, to know, it's a big word, which is just to say that it's your unit of observation or measurement for the data. So for instance, are you talking about the patients? Are you talking about the carers? Are you talking about all the persons living with one specific rare disease, patients and carers? Or are you talking about the assessment of a visit to a hospital? And in that case, one person can assess several visits. So in that case, you won't be talking about the same thing, and the subject of your sentences when you will give the results will not be the same. It can be patients, it can be carers, it can be respondents, or people living with rare diseases. So that's very important, because then if it's not the same thing, if you say that it's patients who said that, but that they're also carers, it may be difficult to publish in a peer-reviewed article. And the variables also, so there's a difference between the question that you ask and the variables. For instance, you can ask for the age of the persons, of the respondents, and you directly have the age, but you can also ask for the birth of date and then calculate the age. So you would still have the age, but it's not a question itself. And sometimes you have to ask several questions to get one variable that is of interest for you. Then very practical tips to write your questionnaire. A good question, what is a good question? A good question is when you have only one question. For instance, if you ask, does your doctor ensure follow-up after visits and have good communication skills? you have two questions and you don't know to which question people will answer. So you will be, that will be difficult to analyze the answer because they may have follow-up after visits, but bad communication skills. So you really need to make sure that you have just one question per question. What is very useful, and given that we are an international community that is very, very helpful, is to translate the questionnaire once it's quite finalized, to translate it in your native language. Then you will see that there will be some difficulties in the translation of some sentences, and that will allow you to clarify those sentences, or sometimes to clarify what you mean. Because you may realize in the end that it wasn't clear to you what you wanted to measure. Use a simple and understandable language. And if you need to use some technical language, try to explain it as much as possible in the question itself or just below the question, because people won't go into an annex and to see what it means. If they don't understand it right away, that will be difficult. Prefer using positive phrasing, propose as many positive and negative items to a question, choose the most appropriate format for each question. And I won't have the time to go too much into detail for the different formats, but that's just some of the practical tips that I can give you. So maybe in the discussions, they will be more coming. And also how to best recruit participants online. To make it simple, it's faster, cheaper, easier, but then you won't have access to all types. Well, you will just have access to a certain type of respondents with more numeric literacy, with access to the internet. So you just have to know that sometimes, especially with rare diseases, you cannot do otherwise. That's the best way we have to reach out to patients and carers, but still you have to know that your sample will be impacted and that you won't have access to the same type of people as, for instance, if you were on site in hospitals. But then distributing questionnaires on site, it takes a lot of time, a lot of energy, and that's usually expensive, because if there's nobody on site to distribute the questionnaires, it doesn't work. You won't have a big response rate. So yeah, just be mindful of the social characteristics of your respondents. The way you will disseminate will have an impact on the social characteristics, which may have an impact on the answer. So just keep that in mind. It doesn't mean that everything that you are saying will be false. It just means that sometimes you cannot do otherwise. And the best way to handle that is to be open and to be clear about that when you answer, when you analyze, and when you communicate on the results. So once again, for the analysis of the results, you have to be very clear from the beginning on who will analyze the results and how. You have to have that in mind, and how much time you will need to analyze the results. For instance, if you want to have open-ended questions in a questionnaire, that can be very useful, because then you will have people's insights on a subject. And most of the time, well, yeah, most of the time in rare barometer, we have an open-ended question at the end of the questionnaire, and that gives us many ideas for further surveys. But at the same time, if you intend to have many respondents, it will take you a lot of time to analyze those open-ended questions. Then, and maybe we will come back to that later, but really when I already talked a bit very quickly about that when I talked about the sample. But then if you want to make, if you want to analyze the results statistically, just be mindful of what you can say based on your sample. So the best way to do it is to only say that this is what the respondents said, because most of the time you cannot have a representative sample for rare diseases. So if you have lots and lots and lots of answers, for instance, for a diagnosis survey, we are now reaching close to 8,000 respondents, then it's starting to be really robust, because what we can see is that usually after you reach out to 1,000 respondents, the answers don't really change much. So it's quite robust. But if you cannot reach out to such an amount of respondents, it just means that you have to say that what you are saying is just robust for the sample and not for the population. So not for all the persons who are living with this rare disease, for instance. So it means that what we call the descriptive statistics, when you give a percentage, when you give an average measure, when you give a standard deviation, it's not really meaningful if you have too few people or if it doesn't represent your population. So you will just have to say this percentage works for my sample and not for the population. However, if you do analytical statistics, meaning if you cross two variables, if you have enough men and enough women, if you're in your sample, and you see how men and women answered to one question, and you compare it, and that the crossing is statistically significant, and usually the statistical softwares can tell you if it's significant, then that works. You have some meaningful relationship. You can look at tendencies that are most likely to exist. So you can do analytical statistics in that case. So the statistical tests, once again, I don't have the time to go too much into detail, but they describe how much the relationship between two or more variables is statistically significant, meaning that it's more or less likely to be due to chance. And just very quickly, compare your results with existing results when they are comparable, and discuss your results with other groups or in focus groups so that you can see how to interpret them. And so, yeah, my final advice would be to only say what your survey design allows you to say. Don't go any further. So when you write and communicate on the results, be mindful of your statistical units. If you asked patients and carers, don't say that it's patients who thinks that's something, because then we often see that the answers are quite different if you ask patients or if you ask carers. Be mindful of the structure of your sample and what it allows you to say. Only communicate on significant results. So just to give you some ways to use interviews and open-ended questions, you can do a thematic analysis. You can use them as quotes to exemplify the results of your measures. Always give a feedback to the respondents or to the people interested in the survey. For instance, those who helped disseminate it, who may benefit from it, and always adapt to your target audience. Would that be patients, decision makers if you have advocacy goals, or scientists if you want to publish in a peer-reviewed journal. So I won't go too much into that because those who know rare barometer know that also, but you can communicate the results through dashboards. You can do it through fact sheets where you have key results, and you can have, if you go to the Rare Barometer website, you can have examples. You can, of course, write a peer-reviewed article, and you can communicate face-to-face in a webinar or in a video to present your results. And this is my last slide. Just to tell you about the specificities of the rare disease community when we do surveys. So there is the sample size that is usually not very high, and the population size that can be also very low. I mean, if you reach out to 100 people, it's not the same if your population is 10,000 people or if it's 200 people, then you would have half your population. So this is something that you need to have in mind. If you do a survey on rare diseases, well, on health-related issues, you are most likely to ask questions or sensitive data as they are defined in GDPR. So the only fact to ask for the diagnosis and the name of the disease, it is a sensitive data. So you can look, you will have the link to the Article 9 of GDPR that describes how to handle that. Also because sometimes there are very few people with one disease, taking away their name may not be enough to ensure anonymity. So you have to be mindful that if you have only 10 people who answer to a survey, if you give a lot of information on their answers, they may be recognizable. So it's not just taking out the names, it's just being mindful that people cannot be really recognized. Samples are not usually representative. The subject of your sentences should correspond to your statistical unit, and always be mindful of the social characteristics of respondents, and also be mindful of survey fatigue. Only do a survey if you think that it is really needed, because now we have more and more surveys every day. So if we could avoid to have too many surveys and to keep this option for something that is really meaningful to you, that would be best. And I'm done. I hope I'm not too late.
Thank you very much, Jessie. That was excellent, very informative and useful. Actually, we were talking this morning and we were wondering what a good number of respondents means, what it is. And so with a lot of practical tips, very nice. There was one question from Ines in the chat. But now is the moment for all of you, if you want to ask Jessie any questions or comment on anything, to use the chat or to speak up and raise your hand. So Ines' question in the chat was, how can we identify bias in our sample? Recruitment is one factor. Is there anything else that we need to or can consider?
Yeah, you can consider. Well, it's not really, that's why I didn't use the word bias, because I mean, we can consider it this way. So it's biased if you refer to a representative sample, for instance. But if we know that we cannot be representative because we do not know the characteristics, well, the structure of the population, then it's not about bias. It's just about making sure that you can answer your questions. So once again, using the example of a gender, we usually have much more women answering to our surveys than men. It can be 2/3 for 1/3. In the diagnosis survey now, we see that it's 80% of women answering. So there can be many reasons for that. But what we have to be careful about is that, so we have to be mindful of that when we do analyze the percentages. If we say that this is the time to access to diagnosis for all people living with rare diseases, we have to be mindful on the fact that there are more women than men. But if we compare the time to diagnosis for men and women, if it's statistically significant, it doesn't matter that there are more women answering. And there are also ways to control that statistically. So it's not so much, yeah, it's not so much bias. It's more about making sure that what you are saying is meaningful based on your survey design and on the sample that you have.
Thank you, Jessie. There's another question in the chat box from Eva. Thank you very much for the interesting presentation. Which tool would you recommend for patient organizations in order to be mindful of GDPR while conducting surveys?
So the one we're using is not very expensive, but you'd still have to pay. So I wouldn't. I mean, we have prepared with the ERN team in Eurodis a fact sheet with all the survey softwares that you could use, but what I would be mindful of is to make sure that it's hard for anybody outside your organization to access to the raw data. So if it's online, if it's all saved online, make sure that there is a password to access it. If it's not online, try to, well, anyway, try to have it saved not online, if possible. Be mindful also of if you use a software, a survey software, usually the answers are saved somewhere. Just look at where it is saved. For instance, the one we use in Rebarometer, it's all saved in France, so it's in Europe, so the European laws do apply. And then it's really about me being sure that only, well, there are two main rules. Make sure that only your research team can access the raw data, and make sure that for the sensitive questions, so health related, political opinions, sexual questions, that you only ask them if it's necessary and if it's meaningful based on your research questions. For instance, questions on ethnicity, it's very difficult to ask them. And also be mindful of the national legislations. For instance, in France, it would be non-constitutional to ask a question on ethnicity and propose specific items in a question on ethnicity. So yeah, you just have to be careful about that. That's the main thing.
Thank you, Jessie. Angela, do you want to ask a question?
Okay. Thank you, Jessie. We thank you for your presentation. Very nice. Sorry. We are facing a problem now because, just sorry. We are having a kind of open survey in ERN Liver. Just a second. Too much pollen in air or pollution, I don't know. So we have a little quantity of questions, open one in our ERN, but we perform a kind of pre-test questions to check the understandability of the questions. And what I saw, it is that it's very difficult, the language problem, because when you have open questions, this matter of language is very complicated. Secondly, it's difficult to quantify. So if we are going to have, for example, 700 answers, what should we do? Do we have a kind of help? And in the scope of ERNs, for example, I don't know, and Inés or Lenia can tell, I don't believe we have a kind of support, and we are having a kind of European survey with open questions on unmet clinical needs, which is very interesting, and we have really good answers, but still is a huge quantity of work.
No, it is a lot of work, and that's what I said before, meaning that if you have an open-ended question and you intend to have many respondents, you really have to think about how you will analyze this. So what is usually done is called thematic analysis. So that's something that is quite reachable for anyone, but that does take a lot of time because there's no way through it. Usually it's best when we do it manually. So it's looking at all the questions and looking at the themes that are being tackled in those questions and organizing the answers by theme. So hence the name thematic analysis. And that does take time. So once again, you know, there's usually this question on what is a good sample? How many people do we need to have a good sample? So it really depends on the population, on the question you ask, on who you can access. And likewise, there is not such thing as just one good question, for instance. So an open-ended question is very useful to have insights, but if you don't have the means, I mean, the resource to analyze it, then it's a bit of shame that you cannot really use it. Still, maybe the fastest way, and one that can be quite easily done, is to go through it and just also pick up the answers that are you seem at meaningful and that do convey the ideas that are present, or counterbalance also the idea that you can see in the answers to the close-ended questions, for instance. So that's a quick way to do it.
And as you mentioned, I think we need to know what question to ask, but also to have an idea based on our experience, what answers we are going to have. So this helps also to read fast and to pick. It is a good idea to do it this way.
Yeah.
Thank you.
Okay, any other questions to Jessie? If not, I suggest we move to
Angelica has raised her hand.
Angelica.
Unfortunately, I arrived 20 minutes late due to a work emergency. And I wanted to ask if it's possible to get the slides afterwards.
Yeah, of course. Of course.
Okay. And I think it was very interesting. I'm a social scientist myself and working in a social research institute. I'm not that deep into statistic and so on, but do a lot of questionnaires and that. And I found everything I heard from you very very good, and nothing I would have to add anything.
Thank you very much. Thank you.
Okay, thank you very much, Jessie. So Sylvia, are you ready to share your presentation?
Yes, Ilaria is going to be starting, but I
Okay.
will be sharing the slides for her because she has limited connection.
Yes,
So
thank you very much, Sylvia,
no problem.
for helping. And thanks to Eurordis for organizing this webinar. And today with Sylvia and Diana, we will show the evolution of our service, of our technique, let's say, from the beginning when we started the first survey just after the kickoff meeting of the ERNs until the last one that we have developed a few months ago. So the first survey we have developed is about the clinical practice guidelines and the awareness among patients and caregivers on one side, and among clinicians on the other side, the adherence for the clinicians. Sylvia will explain the educational survey, the educational needs of our communities, and Diana, who is the project manager of ReCONNET, will give you some practical tips that we have learned through these 5 years. So all the surveys have been co-designed with our ePAGs. So we are talking on behalf of the ePAGs of ReCONNET, a very strong team, with different skills that enable us to give different views and approaches. So here you can see on the left side the names of also the new comers, and thanks to all of them. So in the next slide, you can go, Sylvia. The aims why we have developed the first survey on clinical practice guidelines, because we want to test the knowledge and the awareness of clinical practice guidelines in our communities, in the specific, in the rare and complex connective tissue disease patients, which is the fall of our ERN. We needed to collect the views of our communities from patients, caregivers, and widely from their family members, if they knew why exist clinical practice guideline, what's behind the development of this tool, and see what they expected from clinical practice guidelines. And this, for us, would be the core of our next activities that we wanted to develop within the ERN ReCONNET. So, as I said, we have co-designed the survey. We were at the beginning very few ePAGs, as I guess in all the ERNs, but we worked and we are working very close to with our coordination team. We ask this different kind of answer. We use close questions and so answers, open, and the Likert scale. So you see a variety, and maybe not the best thing to do. Let's see what we have developed through the years. We wanted the survey to be really understandable by layman persons with a clear language. We had a good number of patient organizations in our archive, and we disseminated the survey through these patient organizations that we met at the very beginning of the first year of the ERNs, and also through EURORDIS. We built 21 item questions in English, sorry, and we had 3 sections. One asking general questions like demographics, level of education. Did we really need this kind of questions? But we had at the beginning. And disease specific, we ask, do you have one of the 10 diseases covered by ReCONNET, and maybe also other diseases? The knowledge and awareness of clinical practice guideline, and the subjective perspective of the guidelines. We were very proud because we collected almost 500 answers. And at the beginning, I must say, we made a great dissemination teamwork. But the reality is that only some rare connective tissue diseases have a patient organization. For instance, Sylvia's disease just have national organization. I have an European federation, which make a big, big difference. 62 of respondents were aware of the existence of clinical practice guidelines. We thought that this could be a bias due to the fact that the following activities that we have developed have shown something slightly different. We think that the respondents were people active in the patient organization. So this is why they knew what clinical practice guidelines are, because our experience, but also the daily experience, I think you have the same perception. Most of the patients are not aware of these tools, what they are, how they have been built, and so on. But we also believe that we got a great result because it's been developed just in the first year of our activities. So we were really happy to got almost 500 answers. Then we have published the results on RMD Open, of course, an open journal. And you can see that 3 ePAGs are listed as co-authors of the article: Charissa Frank, Anna Viera, and myself. You will see the evolution also of this subspecific subtopic of the good practice, and Sylvia will show it to you. Anyway, already in 2020, ePAGs were listed as co-authors. So just to wrap up, 25% of the respondents thought that the creation of a patient-friendly version of the clinical practice guideline would be useful. That's why we started with the pilot of developing lay versions for systemic sclerosis. Actually, we have developed a methodology that will be used for all the diseases. And in fact, now we are using this methodology for the translation in layman language of lupus recommendations developed by EULA. We saw that we need for clinical practice guidelines to be applicable in daily clinical practice. That's why we started the adaptive process. So we need the CPGs to be in real life in different countries. So through the adaptive process, we can really consider the social, economical environment of single nations. At the same time, we found difficulty in identifying reliable source of information on CPGs. The result is the repository of existing CPGs that you can find on ERN ReCONNET website, and consider that also ePAGs are asked to provide references of useful CPGs to be updated on the website. But also the increased awareness on the existing CPGs for each disease was found important. That's why in the last 2-3 years, we have developed webinars on CPGs and repository that I said is on the website. Nonetheless, but this is a transversal problem, few CPGs are available. So now we know the tender, we should work as close as possible with scientific society to develop guidelines for diseases that don't have, or at least recommendations, and of course, collect new evidence and with a strong literature review. So now the floor is for Silvia. Thank you.
Thank you, Ilaria. Thank you so much. So I'm going to talk about the second survey, which is on our educational needs. So the aims of this survey was to collect the training needs of our European patients and patient representatives and caregivers affected by rare and complex connective tissue diseases, to plan our future education and training activities of ReCONNET dedicated to this population. So the steps we followed to building this survey: the ERN proposed an initial draft, and this happened, I did here a short timeline so you see how we actually planned the survey. The 9th of November, we received an email with the proposal of the initial draft. Then we uploaded to work collaboratively, and we give a date until the 15th of November so that all the ePAG representatives can look at the survey and give their input. We have a call with the ERN to solve questions and comments that show up on the collaborative document that we did. And we do this the day after that we finish working on the document. And then we do a second iteration until the 21st of November. And then we got the okay from the ERN. And we have the final survey launched on the 23rd of November. So you see that the process actually, by working all together and collaboratively, only took from the 9th of November until the 23rd that we were ready to launch the survey. So as I said, just here to show you concrete details on how we communicate and the important aspects to work fast and efficiently, you see here the email that was sent by the ERN, and these are the objectives of the survey, the further steps and outcomes that might come from this survey, a clear deadline that you see here highlighted and very, very clear so that everyone knows what we're looking forward to, plus more information on what's going to happen on translation and dissemination once we publish the survey. So this is the first draft that got sent to the ePAG group. And you can see that this is just a Word document with the questions and the possible answers. And this is what we upload to a collaborative platform, which in our case is Google Drive. We have a Google Drive folder in which we work on. And then all of us work on it together so we can see each other's comments and build upon all the comments we do on each other. So you can see here, this is what I was talking about. We upload this to Google Drive, and then here you can see the changes in pink. So we are also adding, we are even adding questions that we will propose to the ERN, questions that we think that we're missing. And you can see here the version history on what is saying, who is saying what. We have complete freedom at this stage to add, change, delete questions from the survey, which we will propose to the ERN. The next step, so during this process, what we do is questions and comments arise, and we have a call normally after collecting all the inputs from all the ePAG advocates, and then we have a call with the coordination team, normally with Diana, and then we discuss the intricacies and the questions we have and the proposals with the new questions, and then we if there's changes and they accept, that's it. Or if they have some concerns, we can go back to discuss again with the ePAG group to see how we can solve these issues. So we, after the call with the ERN, we have changes and proposals and final comments. So I am sending an email to everyone because I was part of the call and saying that we are actually changing the survey. So you remember at the beginning, there was a proposal that was for patients and caregivers, and we decided while we were working collaboratively on the questions that it would be very interesting to know if the person replying to the survey was actually part of a patient organization or not. And we decided to actually split the survey and have like two branches, one with questions for people that were part of a patient organization and one branch for the people that were not from a patient organization. We also proposed to help with translations as the resources for translating the survey were quite limited. And then we decided that as ePAG advocates, we could translate for our own languages and we could do this for the dissemination of the survey. Just a short table to show you what was the difference, the two main difference with the draft that was sent by the ERN and our final version. So as you remember, I told you that the target population was the European patients, patient representatives and caregivers. And in our final version, we differentiate all these populations between being in a patient organization or not, which, as I told you, doubled the survey split the survey into two branches. And then in the draft by the ERN, we had 13 questions. And in the final version, we ended up with 21 in total for everyone. So if we compare the two surveys, that's comparing what Ilaria presented, which was done, if I'm not mistaken, in 2018. Ilaria, yes, she's nodding, yes. And the one we did in November of 2021. So Ilaria's survey got 493 replies, and the educational survey got 1,426. So you can see here that we're improving a lot into reaching out and disseminating our surveys. In the CPG surveys, the ePAGs in the steering committee, only the ePAGs in the steering committee were involved as authors in the publication, while in the educational survey, all the ePAGs were involved in the input for the surveys, and they will be involved in the publications. Also, if there are other surveys, for example, that there's patients collaborating that are even not part of the ERN, they can also be part of the publications. They don't have to be part of the ePAG group. The CPG survey was developed in English, while the educational survey, with the help of the advocates, was developed in 15 EU language, plus the translations that were offered by the ERN. There were no questions to profile respondents, while, as I just told you, we did differentiate into different profiles. We had calls in the educational survey, we had calls to co-design and discuss results, and the co-planning of initiatives, and when we're discussing the results to see what is happening in the future after the survey. And now I give the floor to Diana.
So basically, after a 5 years experience, we kind of everyone, I mean, the team, the clinicians and the ePAGs have grown together in this. So we have really built on our experience every time. And we have reached to this point of collecting many answers. And of course, also in having, you know, a plan besides running the survey, but also in the uptake of the results. And this is because it's always a teamwork, as Ilaria is saying in the chat. And we tried, you know, to reinforce this cooperation every time we do the surveys. So we try, you know, to look behind and see what can be improved every time. So we already have, for example, some improvements after the education survey that Silvia was mentioning. So it's really an ongoing process, and we try to learn from each other. So based on this experience, we have tried to draft a kind of stepwise approach for you. We hope it's helpful to start the creation of a survey and understanding which are the main steps that we have, for example, used in the past years. So of course, as Jessie already mentioned, the first step would be to understand what are your aims and your goals. So try to answer to the question, what do I want to know? And the next step is, of course, is understanding the population and the methodology. So who will I ask and how? So understand who are the respondents to your survey, and how shall I ask them? Should I run a survey? Should I run an interview-based questionnaire, or should I do both? So there are different ways in which you can, you know, run this kind of surveys, and you can start, you know, also in understanding whether you need only a survey or kind of also a mixed methodology, as we are, for example, with the education survey. And then, of course, the next step would be to start the design of the survey. And our huge suggestion is always to try to involve someone. It could be your clinicians, it could be other fellow advocates, it could be a statistician. So try to involve and make sure that you are in programming a co-design process. So design surveys and questions together is always a huge factor for success of surveys. And after that, based on our experience, we try to test the initial version of the survey. So we have, for example, Silvia and Ilaria usually test our surveys. And then the ePAG also work on the translations. So again, the network, ask colleagues and help clinicians. There are a lot of people there that will be willing to help you, but do consider if possible to translate your survey and think and to try to answer to the question, does the survey work? Not only if it works technically, but also if it works in terms of the question and on whether they are clear and everything that Ilaria mentioned already. Then very important, plan how you will launch the survey and ask everyone that you know in your network if they can help you to collect the most replies you can get. Again, the networking is usually very important. We usually stress a lot to Lenia to help us in disseminating our surveys, and actually also our ePAG advocates are hugely, immensely active in the dissemination of the survey at so many levels, national, local, European level, and sometimes even internationally. And so ask this question, how do I collect the replies and involve others in trying to plan the dissemination of the survey? And the last step would be, which is very important, to plan the dissemination of your results. So not only the analysis, but also how you will disseminate your results. We usually tend to publish every time we do a survey, and that is because usually there are these kind of huge surveys are not very publicly available in terms of results in PubMed. So especially when we collect the voices of patients, we really want to make the results available. And actually we're also thinking of planning infographics based on the results, learning of course from the Red Barometer team that it's huge hugely important, not only to publish the results, but also to make sure that they are available for the wider public, and so infographics and translation. So Silvia, if you want, you can go to the next slide. So in this slide, basically, again, based on our experience, we try to outline a few don'ts and don'ts in co-designing surveys. So the first tip we would like to give you is, again, to be ready to team up and plan together the survey. So you can go back to the slides that we were just showing before, and plan how you can involve others that can help you, because they have already planned the survey, because they are involved in your network. So be ready to work in a team, because that is a huge factor for success. And another question, and sorry, another tip we would like to give you is that it's really, really important to ask the right questions to the right people. It might seem, you know, easy, but sometimes we have faced that some questions that we were asking were, for example, a bit more relevant for caregivers rather than for patients, or the contrary. So it's hugely important to think of the respondents of your survey. And as Silvia has already mentioned, it's really important to explain in the introduction, and possibly also when you disseminate the survey, what is the goal, what is the aim of the surveys, and thank them for their huge contribution, because it is a huge contribution. Every single voice is important. And yeah, this is a kind of a small repetition, but I would like to encourage all of you to really don't feel frustrated that you don't have the resources or the power to run surveys, because the rare disease community is always there to help you. And please make sure to build your network, or use the network you already have, ask, and people might be ready to help you. So for example, our ePAGs have built actually a sub-network of patients representatives that help them and help us every time we run a survey or we need a translation. And that's because they build their own network, and these people are already available to support the translation. So this is an example of what you can, you know, plan when you do survey, not only in the ERN, but in general. And it's really, really important. Do not forget to test your survey before you launch it. Ask not only someone from your organization, but also someone that is external to your organization, or that is not really involved, because sometimes the external point of view can be essential in understanding that maybe some questions are not really friendly. And when you co-design, so when you participate in a co-design of a survey, don't feel afraid to bring your contribution, because when you are co-designing a survey, you are there because people want to hear your voice and your opinion. So be ready, propose, and don't feel afraid to tell your opinion. It's crucial that you give your opinion. Again, this might sound a little basic, but sometimes we see surveys that are being built and organized with a lot of results, but then the results are either not published, or they are just, you know, used internally. So when you plan a survey, already think at the beginning of what you can do with those results, not only how you can disseminate them, but also how they can be useful for your community, or even for other communities. There are initiatives that are done, for example, in our ERN or in other ERNs that you can take advantage of. And so this is kind of also a way of making sure that your results are used and that are taken on board at every level. So I'll try to be quick with the don'ts, but Jessie has already mentioned a few. But as I was saying before, you don't have to feel afraid to bring your contribution. This is so important, not only when you are co-designing surveys, but also in proposing new survey. You can ask to run a new survey, team up and ask. If you are part of a co-designing group, don't feel afraid raise your voice and tell what you think. If you want to contribute to a survey, don't feel afraid. If you are, I don't know, you have concerns in terms of GDPR, ask questions, but make sure that you bring your contribution as much as you can. Again, this is very basic, but try to avoid too long questionnaires if it's not needed. This is so important. Sometimes long questionnaires are needed because, for example, a topic was never explored, or because a topic is so complex that some questions need to be addressed. But if it's not necessary, try to keep the questionnaire as short as you can. Next point, yes, I like this point a lot. Don't underestimate the power of data. Surveys are a very, very powerful tool to explore topics and ask individual patients and caregivers on their opinions, needs, and priorities. It's a very helpful tool that can help shaping not only your advocacy, but even research agendas on in addressing the unmet needs. So don't underestimate the power of data, but on the other hand, as Jessie already said, try to not overload your community with surveys too much. And there are different ways in which you can do that. You can, for example, plan a survey that has 2 dimensions, so you explore 2 topics in the same survey. Or, for example, you integrate other methodologies, so you can plan a workshop, or you can plan interviews. So you can differentiate your ways, but try not to overload your community if it's not needed once again. And we go to the next point, which is, again, disseminate and share. It's so hugely important that the results of surveys are shared, even if they are negative, even if you think they are not relevant. Clinicians and other patients might want to look at them, and don't also forget that some policymakers are also sometimes going into publications to see whether some topics were explored or if there is anything that was published. This is very, very important. Disseminate your results at any level. Again, in ReCONNET, we are using the publication, the scientific publication, and also the infographics for patients, as Jessie was mentioning. So this is one of the ways, but you can find your own ways. Last point is, again, a very important point. If you are planning a survey, ask someone to help you, and make sure that that kind of data is not already available. So the surveys need to be planned when you really need to run it, and when you really need to explore that dimension and collect powerful data. So, for example, you can make a very quick search on PubMed, or even in Google. Sometimes you can find some useful references. And if you don't know whether that topic was already explored, again, team up and ask someone to help you. We already have huge networks, so and Eurordis can help you also in finding someone that can reply to your questions, but make sure that the survey is run only in case there is not already a reply to your research question. So I think that was it for our do's and don'ts. And basically our idea was to share our experience, but we are proposing to you these email addresses in case you have any questions, or in case you might want our help for anything. We are there to help you, and please don't feel afraid to get in touch with us. We hope this was helpful for all of you, and thank you so much.
Thank you so much, Diana and Ilaria and Sylvia. I think that was some excellent presentations with a lot of information, and coming just also at the right time. We are aware that, you know, designing surveys is a big learning need, at least amongst the ePAG advocate community. So thank you very much for that. Do you have any questions? Are there any questions to the presenters?
Perhaps I have one for Sylvia and Diana and Ilaria. Did you include in your training survey any open-ended questions, or were they all close-ended questions? And if you did include open-ended, how did you analyze them? How was that done? So just to follow up with what Angela has just asked, let's say.
We had open questions in our first survey, and actually they have been analyzed by the ReCONNET coordination team. So maybe Diana, you want to spend a few words on this?
Yes, so we usually always leave at least one open box at the end, but in general we always use open box because we are aware that, of course, our questions might not be sufficient, to collect the views or the perspective of everyone. And so we try to always keep one. And also based on our experience with narrative medicine, it's so important, to give people the power to speak, even if a question is not there. And so basically what we do, depending on the survey, of course, for the last one was the one on education, we collected almost 1,500 replies. So that was a bit bigger in terms of the data, but we try to analyze every question. And there is usually we have one statistician that helps us in collecting the results, but then we make sure that at least a couple of people are looking at deeply also in the open questions, because sometimes you find a small pearls in these open box questions. And Ilaria, for example, you might remember we also left a few boxes open also on the questionnaire for the clinical practice guidelines, and we understood that is so powerful, to leave people the possibility to speak. Burden, we know.
And Diana, those responses were in different languages, I am assuming?
Yes.
Open-ended. And then what did you do? Did you translate them? Did you do thematic analysis? How did you go?
So we are not that far yet. So the statistician is still elaborating, the cluster analysis and all the correspondences. But once we will get there to the open questions in different languages, basically we will collect them all and per language. And we will share them with our ePAG advocates, and they will look at them, hopefully. There will not be too many, actually, because, we collected 1,500, but not everyone is, of course, bringing, huge text boxes which is a limited space, of course. It's not unlimited. There is a limited space, and they will elaborate them. And from our part, we will try to use a translation service also, just to look at them and to make sure that we are not missing anything, but we usually use the same methodology, that both of us look at the same results, and then we share our opinions and we draw conclusions from that results.
May I add something? It's been really interesting because preparing for this webinar, I went back to the answers of the CPG's survey with a new way of approaching the data. So I searched for different things now in the sub-analysis, and I found this very, very, very interesting, because the results can be analyzed also after 2 years searching for different things, for different answers. And regarding the open questions or open answers, I think this is the way to better engage our communities, because you let them the possibility to express themselves. Maybe you don't use this information because it's not useful for your research, but at least you give them the voice, the power to be heard.
I hope that you will use that information.
That's for sure.
One of the things
That's for
Jesse
sure.
said, and I hope everyone listened to that, if you don't need something, don't ask. And if you ask, use it. And there is a lot of good information on open-ended questions, but
For
you need to
sure.
be very careful when you analyze that, and maybe, well, you can follow up with Jesse. You need to be very careful and choose your methodology to analyze that. But happy to see that you at least, that you include at least one open-ended question, because I think it is also, it is very relevant. It is very difficult, and it adds a little bit of a challenge in terms of analysis. But you're right, Ilaria, it helps to engage the community a lot.
If you then give the results.
If I just, before Angela, I just want to make a comment on this. If someone here, because we are talking about making surveys, but obviously this is a bit tricky because we have the coordination team, and Diana just talked about involving a statistician in the data analysis. But if someone here is attending this webinar because they want to do it within their own patient organization, and obviously the resources are not going to be the same, you can do exactly the same as what Diana was saying. Like, for example, this is not the scope of this webinar, but Lenia and Diana and I designed a survey to look at which is where this webinar comes from, actually, the needs of ePAG advocates on training. And we did have an open-ended question there. And what we did was we looked at keywords, because in the end, if you're asking questions, doing a survey to a specific community on a specific topic, in the end, you're going to get the keywords that come out. So what you do is basically in Excel, which is mainly where you're going to get your results, you start taking out keywords by, imagine someone that has written a paragraph, and then you put the keywords, and then you can count the keywords, the amount of times the keywords were mentioned, for example, and then you get there a first analysis on what people are telling you from the open-ended questions. So you don't always need a statistician behind, and surveys are doable with open-ended questions as well within smaller patient organizations with not so many resources behind.
Good comment. Thank you, Sylvia. Angela, please.
Yes, Sylvia, concerning patient organization survey, it's easier because you have one language in general. You are in a country, so you know exactly what you need to do. But the point is when you have European survey and different languages and different points. So what we are doing now, because we are in the middle of a process, and we decided to send the questions to 5 different patient organizations to disseminate in 5 different countries. So we start from questions in English, then a translation in native languages where the survey was disseminated, and ask back to people to collect the answers in their own languages and translate back to English. So you can imagine the work. And I think what we will need to do is to reduce the number of countries, reduce the number of, because we have already uniquely 4 questions, but still 4 open questions in big quantity of countries, and so it will be really hard. So the problem is also a matter of language, and to have to collect back in with interpretation of a native of these languages, because the tools we have for translation is not always acceptable.
Yes, I think
our experience.
Yes, I think with Lenia's survey that we did, we had 130 respondents. As Ilaria was saying, and Diana, not everyone is going to give you a reply to an open-ended question, but we resourced to DeepL and Google Translate to translate the open-ended questions, because we don't have, obviously people were replying from German to Swedish to, And this was only in English because it was for ePAG advocates, so everyone speaks English. But it was I found this very interesting. In an English survey, people felt the liberty to reply in their own language, which I was not expecting at all. So we had to translate, and then we were doing that with keywords, but obviously you lose in some languages because people as well reply very colloquially when you ask very personal questions. So yes, you are going to be missing this, the finesse of the answers. I do agree, Angela, that, and Diana can confirm this, that having different languages and even translating, finding the resources is complicated, but depending on the scope of the survey, it's crucial and it's needed. And you have to maybe choose which maybe countries that are better target for what you're doing, or if you have patient organizations in specific countries, to target that and get their help. And this is what Diana was talking about, as well as relying on your community and strengthening your network and building on this to make better surveys. I also think that if a survey is well designed, like all that Jesse talked about, if you do a very, very good survey, when someone reaches the end of the survey and you ask them, is there anything else you want to say? If the survey is well designed and you ask very good questions and your answers are very comprehensive, and then mostly, and maybe a lot of the people will say, I said everything that I had to say. So maybe your open-ended questions will be just, very, very scarce or very, very short.
Well, at the same time, if I can say a word on well, open-ended questions and translation, actually, well, I may start with translation. So it can be a hurdle because, I mean, for instance, well, in Eurobarometer, we translate everything in 23 languages, so we cannot just rely on patient organizations. We have to, that's a big part of our budget because we do it with professional translators. But then, of course, there's a question of translating the answers, which is a bit different. But one thing that I said in my presentation was that we can take advantage of the fact that we are international communities usually, even before disseminating the survey. I mean, that can really be useful for the clarity of the questions. For instance, in Eurobarometer, we are French. And one good aspect of English is that it's very concise. But one good aspect of French is that it's very precise. So whenever, even before sending the questionnaire in English to professional translators, we do translate it in French first, because then it allows us to improve the English and to see which are the difficulties that there could be for other translators and even for people who answer in English. So that's one aspect. That's also one good asset to be international. Then regarding analysis of open-ended questions. So, yeah, of course, there is this question of translating the answers. Could it be, of course, you lose some understanding of the answers if you use DeepL or Google Translate, but still, if that's all you can use, you still have a good insight of what people say. So really the difference that there could be, well, there are different ways of using open-ended questions. If you want to use them thoroughly, then, for instance, using thematic analysis is useful. But thematic analysis, basically, it's highlighting parts of the answers, and you use one color for health, one color for jobs, one color for whatever, and then you compile all the themes together, and then you analyze it based on the answers and on what people tell you. So that's one way of doing it. That's the thorough, the really complete way to do it, but it takes a lot of time. It really takes a lot of time. So if you cannot do that, one way that you can use it for is a bit like for an interview. For instance, you can use it as a narrative, because most of the time, especially if the open-ended question is at the end of the questionnaire, people will tell you more about their experience. So your survey can be very thorough, and can be very well designed, but sometimes, and you know it, most of the time, people just need to talk about their experience and be heard. And that's very useful. So that can be used as such. If you make sure that it is anonymized, because sometimes, for instance, Eurobarometer, people tell us the name of their doctors, for instance, so you just have to make sure that you anonymize everything. Another way is to analyze the quantitative data and then look at the open questions and see if there are any subjects that you didn't take into account in your questionnaire. For instance, so we did a survey on COVID-19 and what was needed for people during the COVID-19 pandemic. And the open question, we didn't expect that, but there were, well, now it's obvious, but there were many things on remote healthcare in open-ended questions, and we could use it to see, well, what would be needed, what was good practices and bad practices for remote healthcare. And we use the answers and the analysis that we did of those answers in open-ended questions to write the questions and the items on remote healthcare for our next survey, which was on the future of rare diseases. So you can really have a big insight that you didn't, things that you didn't intend to see in your questionnaire. So that's another way of using them. And a third way of using open-ended questions is to exemplify. So, and to make your report, for instance, more lively. So you can say, okay, so we have, what was it, 80% of people who do not expect to have a cure for their disease by 2030. And then you say, so this person is saying that. So they don't expect to have a cure, but they do think that care coordination can be improved. We have it with figures, and now we have someone saying it in their own words and see how it applies for them, for their specific situation. So that's another way also to show people that they are heard, actually. And just to tell you about another aspect of open-ended questions and another aspect of surveys that can happen is that because you hear people and you listen to them, they can also ask for help. And sometimes if you read open-ended questions, and I mean, you're patients and carers yourself, so you know about that, but sometimes it can be very emotional. So you just have to know that, and also don't hesitate, well, to know also that the fact to listen to people, it's already helpful, but sometimes you have to go a bit beyond. And we do usually have people, because you have to give a contact when you do a survey, and that's also part of GDPR, because people need to be able to ask questions on the survey and the use of the data. And sometimes they contact you for help. So that's also important to be prepared for that and to know who to send them to. So sometimes we send them to other patient organizations or to some of our colleagues. So yeah, just know that there can be that either through email or in open-ended questions. And if you listen to people, and if you want to listen to people, you have to also think about how to answer to those cases.
Thank you very much, Jessie. And well, we are 2 minutes over time already, so we need to close the webinar. I want to say a big thank you to our presenters and to all of you for participating. We will share, of course, the recording with you and the presentations and the contact details of some of our presenters. If you have any follow-up questions, thank you for providing that. And yes, I wish you a very nice evening. Thank you.